Baik, berikutnya adalah sambutan yang akan disampaikan oleh Dr. Farruk Qureshi, Technical Officer WHO Country Office for Indonesia. Good morning, Dr. Farruk.
Ya, selamat pagi, good morning.
Selamat pagi. Silahkan, Dr. Farruk.
Ya, can you hear me well?
Yes, of course.
Okay. Terima kasih, Bu.
Silakan.
Ya, selamat pagi semua. A lot of thanks to the organizers and a lot of thanks for every single participant, and especially Ibu Neti, Professor Rizal, all the Wali Kota, mayors and Bupatis, also the union and the campaign for tobacco-free kids, especially for Patara for his great effort with the whole team to yet again bring us all together. We all are fighters, we all are soldiers of tobacco, and we all are part of the big tobacco control movement that is in Indonesia. And I've been just starting my day with thanking everyone to be part of the story, and that is going to change this country. This is a big marathon, a long marathon, and we have to be part of it. And inshallah, that marathon will really move the way we want it to move. So just I started this because I just wanted to not only just be formal in this session, but just wanted to be taking up from the discussion that Ibu Ayo and then Patara have started, to let everyone know that one major area of work that we really wanted to bring up, and we wanted to really, think in terms of supporting the smokers, because unfortunately smokers have become smokers partly by not knowing, partly by thinking that this is part of the culture. And now it's time for us to also help them to get out of this addiction habit. And while we are talking about tobacco control, that is very important to create an environment to support tobacco control, to support people getting away from smoking. It is also very much important to help them in any way we can, to help them, to motivate them to become a non-smoker. And the whole idea, the whole effort of all the partners, every single one of us who is in this meeting right now is now also towards that. Ibu Ayo and then Patara mentioned about this big campaign with youth ambassadors now taking charge as soldiers to stop smoking, to help smokers quit. The soldiers are not only to monitor but to help, and this is the rationale of this campaign. I would also like to bring from WHO side that with the support of all partners, campaign from tobacco-free kids, especially Patara and the union, we have been able to really create a number of different initiatives. And thanking every organization who is involved in that. The one of the initiative is to now not only help them quit, but also try to find a way where we can help them quit over a time. So talking to a person at one point in time is important, but also letting them being supported throughout a few months would be most important if we really want to get the benefit of having people stop smoking. And that is why, if you allow me, I will like to just quickly share 3 slides. How can I share it? Oh yes, I am. So at global level, WHO has started a campaign to involve 100 million smokers towards quitting in 2021. And that was important because of COVID epidemic. And that was also important because we need to support smokers. Now, for us, it was important that we bring it to Indonesia. It will be important also to bring it in a language and in a manner that would also help smokers in Indonesia. And that is where what Ibu Ayo mentioned, Berani Berhenti campaign started. And this whole project is part of, you can see different hashtags, different way of asking to stop smoking. But this is, as Patara mentioned, a multi-partner initiative and a part of the whole process to engage smokers. If you see on the slide, the WHO has a pledge to quit global web link. But for us, it was important to link it with the Indonesia. And here we came up with the support of all the partners, biraniberhanti.com. That is right now active. That is very interesting because all the youth ambassadors and all the participants can actually direct all the smokers to register so that they get down the line automatic support to quit smoking. And that support will be through messages. That support can be also through dedicated counseling, and that maybe later on, if they do need that support, they might be also helped with the health professionals. So that's the bigger idea and a long-term idea. And in order to do that, biraniberhanti.com is now also initiating, from the last week, they started a full-fledged communication plan to reach out to around 15 million smokers, so a target of around 75 to 100 million Indonesians. Here are a few links related to Facebook, Instagram, and Twitter, and we recommend if you can use this, you can go on this, you can try to retweet. Please suggest to smokers to register to this microsite because that is #1 link to the global Commit to Quit campaign. And secondly, that will also generate the database where the smokers can be supported for later on. And it's not only that we will support that. One of the bigger idea is that to create the health systems towards cessation support, to help the health workers become better cessation support counselors. And while thanking the union for taking a lot of initiatives, including supporting the health system in various kabupaten and kota, we are planning now to help the ministry to develop an e-training learning program that will be available free of cost, that will be available for every health worker, and probably that will also be available for every youth ambassador or any ambassador that would like to be part of supporting cessation support. So that's also almost in the final stages. So with just these 2-3 slides, I just wanted to just thank and share back and reflect back that the whole idea of cessation support and helping people, smokers, should be now a long-term activity for all of us who are helping tobacco control in Indonesia, because that is where we will create new friends, new partners, those parents who are addicted to smoking, but they want that their children shouldn't smoke, those people who know that who are addicted to smoking, yet they think that they should be part of stopping tobacco use in the country. So please, we look forward to continue this support. Again, thanking every single person and especially the union for this great effort. WHO will continue to support. WHO will be liaising with health ministry and other ministries to ensure that this Birani, Birhanti, or soldiers of stopping smoking, soldiers anti-Rokok become a long-term commitment on part of Indonesia. So thank you very much, and over to Parian.